Okay.
Good evening, everyone.
Okay, good evening, madam.
Yes,
It,
as suddenly off from you, as everyone. Okay, thank you so much invited for this session today, and thanks IFPH channel and technicians and host and team members. Today I am presenting my case. Please able me, host able me, please. I want to share my
okay,
screen.
sure.
Thank you. Admit also for everyone, please.
Yes,
Admit my
Meeting
participants
admin.
now.
Sure.
Okay. I am Dr. Tanzila Khaliq and I'm presenting my compulsive disorder case. Firstly, we can see this in our repertory, compulsion disorder, compulsion, thoughts compelling, and compulsive disorder, thoughts compelling, and compulsive neurosis. Basically, this is the case of the compulsive neurosis. And in this, under the rubrics, checking twists or more must check, forgotten something feels constantly as if he had forgotten, and the gesture makes thoughts compelling and washing desire to wash. Next, we can see this the case of the compulsive disorder and what are the symptoms. Patient name is Mariam, age 30 years. She was married, one son, 11 years old, husband foreign in Saudi Arabia, 38 years, sibling, one sister. Hello, please, Ajit Kumar. Okay. Sibling, one sister, mother killed by father when she was 3 years old, and father's very harsh attitude, dominant and dictatorial person. Four step brothers and a one step mother. This is the introduction of my patient. Before starting my case, I want to share what is the obsessive compulsive neurosis disorder. Obsessive compulsive disorder, in short, OCD, is a common, chronic, and a long-lasting disorder in which a person has uncontrollable recurring thoughts, obsession, and or behaviors, compulsion that she feels that urge to repeat and over. What's OCD? A person who fears contamination with germs may wash their hands repeatedly. Obsession compulsive disorder OCD is a mental health condition where a person has obsessive thoughts and compulsion behavior. OCD can affect men, women, and children. Obsessive compulsive disorder OCD is a mental disorder in which people have unwanted and repeated thoughts, feelings, ideas, sensation, obsession, and behaviors that drive them to do something over and over compulsion. What are the symptoms of the neurosis? Now we can see the list of the symptoms. Neurosis symptoms in anxiety and apprehension, excessive worry and guilt, tendency toward more negative emotions and reactions, irritability and anger, low self-esteem and self-conscious, poor response and stressors, and interpretations of every word every day, and situations and threatening depression. These are the symptoms. Neurosis is the referred in class functional mental disorders involving distress but not delusion and hallucination, where behaviors is not outside socially acceptable norms. It's also known as psychoneurosis and neurodisorder anxiety. These are the different. This is also is the other way, and this is again chart. We can see this compulsion and compulsion neurosis with the rubrics. We can see compulsion neurosis have the 1, 2, 3, 4, 5 symptoms, and at this last washing desire to wash. And now when I was click the washing desire to wash, it has more 3 rubrics: cleanliness mania, fear diet of bathing desire to bath. So I was click the desire washing desire to wash. It's you can see this is a compulsive neurosis symptom. And when I read more about the neurosis, the Sigmund Freud, I got Freud article, and he says about the neurosis, pleural neurosis, also called psychoneurosis, or pleural psychoneurosis, mental disorder that cause a sense of the distress and deficit in functioning. And neuroses are characterized by anxiety, depression, or other feeling of happiness or distress that out of the proportion to the ma'am, please admit the participants functioning and virtually any area of his life, relationship, and external affairs, but they are not severe enough incapacitated the persons. Affected patients generally do not suffer from the loss of the sense reality seen in persons with psychosis. This is the article from the period. Now I'm starting my case. Variant number 1. Yes. The patient is with her auntie and inflammation dot menses problem. She shared me about the menses. She got pain from this, and these menses are less, and pain is very much, and many problems came up during the case taking. And she told me a lot of data about her problems. Says, doctor, usually I am very angry when my son does not go to tuition and does not pay attention, and he uses mobile a lot, and I get very angry. So I asked, what you doing on in this anger situation? She says, I always give the slap on her face, and I'm starting striking against this situation. And I say, you follow me. And so mostly she anger on trifling. So I got this rubric, mind, anger, easily. His father loves him. This variant actually patients told me about her son. She said that when hit my son, so mostly her father calls me and says that love to his son and don't hate him. That you should to love his son, but doctor, tell me what kind of tension I get tired of. I don't get so much tension now. So I took this rubric, delusion persecuted, because she was victimed by his mind. My husband has been in Saudi Arabia for 10 years. 10 years promised, but is still not successful for good job. And my house is same old, not no change, no updating in her life, and no even a bathroom is high because she is a very lowing area of the house. She the house is not good looking, and they stay for 2 months and then leaves every year, every 2 years. But same position, no change in my walls and mud house. Half house is a mud house, and have no strong walls and roof. So I'm very disappointed on this situation. So I got two rubrics there: ailments, disappointment, and confidence lacking, no self-esteem. I was no interrupt to my patient Mariam, and she talking, and she's starting her story to me, and talking a lot of about herself. She told me about the childhood and about her life. She told me my grandfather loved me very much. My grandmother loved me very much. When my father was angry, and her elders and my father was angry, and grandfather used to be angry with him, and Mariam kept talking about her past for a long time, and remembered her elders when during the case taking. So I was not interrupt her, and she telling me more and more, like what happened to my mother. I am sitting behind head of my mother's dead body. She killed. She says me, I can't tell you how to dead my mother. Grandfather used to love me very much, and grandmother also. So I took there mind, dwell, past, disagreeable occurrence, and grief. Therefore, what's grief? The grief is the feel sorrow over something, especially people who have died. Most common use of grief has to do with death, usually. And there are grieves family members and grieving friendly, feeling sadness and over the loss of loved one. I took second rubrics there, mind unpleasant thing inclined to dwell on. This rubric have the five remedies. So we can see this rubric also: washing, desire to wash, mania, and or desire to wash. And it has the 27 medicines. Now we can see warrior number 9. The patient said that I sleep late at night because I cannot sleep properly until my husband calls me. And yes, I asked her, why you calling at midnight to your husband? Because it's very comfort time for sleep, and he also hard work person. So you should too must take rest and care of your husband. She says me, I understand, doctor, and I know this is a resting time. but I can't bear this situation. I can't, I feel insecure. So I am afraid because my washroom is the outside the boundary of the house. There is a rough yard, and when I want to go out at night, I feel very scared. Then often, when I feel more scared, I make a call that then take my mobile with me to the washroom. I am at home, and my 11 years old son, we were the only two people in the house, and if she is not on call, I pick up my son. I took their rubric ailments from disappointment old, and no, this is not rubric. Basically, she is feeling the insecurity and sensitive, and this sorry for this rubric. I can took this rubric there. This is their fear insanity. There is the fear insanity. Yes, maybe something wrong with this. This patient said me, yes, there is the fear insanity. The second, fear insanity mean a lot of time she feel the insecure, and sometimes shrieking, and sometimes uh, fearful suddenly. Auntie also sitting with her in my clinic, and auntie said me that her father harsh and spoil attitude with her daughter and a history. He was very angry with his daughter since childhood. She lost her mother also. So I took this rubric, their ailments from neglected being father once. She got early marriage, and she has been a lot of lack of love, and all of the loss of the relations also, and but don't stay with her long time, and she spent her childhood alone, mostly with the cousins and other people. So got married in early age, and husband also left her in early time after marriage. So she was very she faced very problems, and also psychological problems in also. So there is also she looked her self esteems, lack of the self esteems. There is a chart of the netromure. I given her the netromure 200, and second time 1M also, and after 1 month she tell me, I am I feel good, and I'm now I am not washing my hands. I have controlled my this problem, and I presenting the follow up in my basic class, and most of the persons a witness of this case. Here's the voices, audios, videos, and sent my follow up in my class, and most of the witness of this case. This is the some of the charts of the netromure. This when she feel anger, and sometimes she forget. So memory weakness, memory, mental exhaustion, and fatigue from. She complained about the fatigue also and exertion also. It was the ailments from the domination, disappointment, and I took the first rubric, the hysteria, hypochondriasis with. These are all the, yes, this is the heart easily mentally talking players and host talk. This was the case. We can see the keynote of the Netromure. Basically, emotionally vulnerability, leading introverts, and great sense of the responsibility also. And this is the keynote of the Netromure. Hysterical tendency, emotions cannot be controlled mostly, and hysterical sobbing with the shakes, spasm, and twitching also, changeable modes, and emotionally strong attached, just like Mariam. She is attached with her husband, and she is very loyal with the relations. A lot of time her husband left the country, and but she is not think against of her husband. So depression also sad, and she was not weep during the case taking, and most of talking about the past. So I took the dwells on past disagreeable occurrence and sensitive, a lot of sensitive. When I was talked about the friendship, she says that I have no friend, I have no company, I'm living alone with my son. Because in our culture and in our society, people, okay, people have no good look, and to which girls have friends, because we are not allowed in our culture go to the other rooms, other houses, and we are not allowed to meet other people. So she says that she is very cultural lady, and fixed ideas, good or bad. Netromere have the fixed ideas, good or bad. And last stage, last control, absence, and shameless. You see, this is other cultural people. And tantrum when repairment, aggravation, consolation, slow learning, and low talk. This is the Netromere. We can see more Netromere about the adaptation. Why Netromere sick mostly. This is Netromere rubrics. These are all rubrics from the scientists. And in this case, my first rubric is the hysteria, hypochondriasis with admonition ailments. Thus, adaptation is a very dominant rubrics in this case, because uh, she was not abused after marriage, because her husband loved her, and a very emotional relation, both of them, between both of them. Just she was feel angry sometime when she think about of the murder, because she was her mother was killed by her father, because her father was very suspicious, and her mother also was very polite and good lady, consider among people. So she feeling the ailments from anger, silent grief with. This is rubric. And ailments, anger suppressed also, So ailments from care worries and disappointment old only netromure. Ailments from disappointment old only netromure. Yes. In her susral, she was not living with comfort life because her sister-in-law mostly discord with her and criticize. She demanding money and she demanding the more and more in her house as a guest. She lived in her house as a guest, and she says that I feeling not well. I can't join the guest. But she was mostly criticized to her, and when she after she involves in the sickness and historical hypochondriac fitness also. Ailments from discord friends between ones, ailments from discords parents between ones, ailments from domination, and ailments from embarrassment, ailments from emotions. This is the we can see that ailments from fright, old fright from her father. This rubric we can see ailments from fright and grief silent, honor wounded. Okay. And she was neglected by father and mother also. Ailments from offended being. This is the rubric. And from susral, ailments from reproaches, rudeness of others, and unhappiness. These are all of the dominant rubrics, and this was the net premiere. Are you agree with me? Any question?
Okay, doctor, thank you for the presentation. And those who have question, please raise your hands and ask question to Dr. Tanzila. Complimentary. Agree, ma'am. Potency, she already
Yes,
told
I
200.
given. Yes, I given 200 potency, and after she felt better, but after 1 week she was again involved in this problem. So I given the one impotency, and she is feeling well now. Alhamdulillah. She came again with the few patients. She visits with her family members and feeling well now.
Thank you, Dr. Tanzila. And other participants, please. So how long you are treating this patient, doctor?
Yes, yes, please. Yes, ma'am. Anju.
How long you are treating her?
I, my patient Mariam was very soul by temperament, and because she spent a lot of time alone in her life, and she has no experience, and she was not clever. Basically, she is cultural lady and traditional also, and very religious girl. Most time spent with the cleanliness in her house, and make lunch, dinner, different dishes for her son, and most of time spent with her husband on phone calls, and she living in street, one street of her father, her cousin, and her auntie and uncle living in one streets, and most of five houses in one street with the relatives. But she is live only her home. She's not changes and no visits in her father's house. A lot of time spent in her house. She want no meet with him because she missed her mother. But after treatment, is she feeling well? And she says that no, I have no rush of thoughts and now feeling well. And now she is ready to go Saudi Arabia to go to with live with her husband, because she was not go to the Saudi Arabia because she was not well, and she was not avail the doctors in Saudi Arabia for this psychological issue. And she took the psychological tablets also, antiseptics and anti-other anti-depression tablets, but was not get relief from this. So it's very successful case of from homeopathy. I read the statement in allopathy, compulsion, obsession, obsessive compulsive neurosis disorder have no treatment in allopathy. So when I read this, so I feel very sad that I'm very happy to see that in homeopathy we can solve these problems. Just we need the understanding the rubrics, understand the patients.
Yes, thank you, madam.
Thank you so
How
much.
long you are treating? When she came to you? I mean, how many days now?
Oh, after 3 months, I got fully result.
Okay.
After 3 months, yes. When I give the remedy, a lot of call received call me, sometime weeping, sometime laughing, and sometime says that I'm washing cloth, I can't give me remedy, because she was habitual the tablets. So she was leave the all tablets, antidepressant tablets. So 3 months joined. I was not given the other remedy. Just I says that gives I gives the tips of the religious tips. I says that read third kalma, and I read the make wazu and recite the Quran, and she felt very calm and comfort after this. She says that I'm feeling the comfort from Surah Bakara. Just I was not changed the remedy.
Okay. Okay. Do you have ADHD patients and how you're dealing them?
Yes, she was involved in the fibroids, but it's also under process. So I was not at the in this case.
No,
Maybe after.
no. I know you, today you talked about the obsessive compulsive disorder. Even though I'm asking, if do you have ADHD cases successfully treated and how you are dealing with that? Participants, if you have any questions, please raise your hands and ask questions. Mila?
Good evening, everyone.
Okay. Good evening. Good evening. Please.
Hello, hello.
Congratulations, Dr.
Can you hear
Tanzila.
me? Yes, please. Hello. Yes, please.
Congratulations,
Hello.
Dr. Tanzila.
Yes, thank you,
Hello.
Dr. Iqbal. Thank
You
thank you,
solved
Dr.
the,
Iqbal.
according to Homeopathic laws, very nicely case. We always learn
Thank you.
from you good and fruitful. I think this form IFPH is a very nice ground to learn. Thanks.
Yes, sure. Sure, Dr. Mohammed Iqbal. Thank you so much.
Honorable Lady Dr. Tanzila Saiba, and
Yes, thank
host of IUFPH and honorable member of IUFPH. Assalamu alaikum and evening. Good evening. It is once again a great pleasure for us learn precious and wonderful cases solved by Dr. Tanzila, such as OCD, obsessive compulsive disorder, or autism, or any other psychological problems solved by Segal method. This is a beauty of homeopathy, and especially mind method, where incurable cases are cured by homeopathy. I appreciate to Dr. Tanzila and congratulate to present such a beautiful case. And also I appreciate the forum of IFPH, which present under the umbrella of such a nice and beautiful and incurable cases. Thank you, Ji.
Thank you, Dr. Muhammad Ali. Thank you so much. Dr. Muhammad Ali is the member of the Homeopathy Academy, and he witnessed also the case.
Okay.
Okay, thanks to all.
Um,
Most of the cases involves in the psychological issue, but always we should remember that they are also involved in the physical problems. But we are not mostly highlight the physical issues because if we can solve the mental problems under the immune, physical issues are automatically solved.
okay.
So we should must see the what are the patient the concern and patient problems and how to spend life, culture, status, and everything is most important in our cases, mostly in our chronic cases.
Okay, doctor. And participants, if you have questions, please. It is the time to clear your doubts. So please ask questions.
Anyone have doubt, please can clear at this time. Master Hariman always says that we should do a physician should must alert during the case taking. Why we should alert? Because when we case taking, we are missed some of the necessary data about the case when we make the produce a leading question, because our patients tone expressions and true data, true talking of herself and himself is the most important. And if a patient giving us the natural tone, natural expressions, natural talking, this is the true data and true. We should to make the true totality of the patient, and in short time we can understand our patient. So always avoid the leading question in your patients to your patients. Thank you.
Dr. Anupam is asking.
Yes, please.
Ma'am, good evening. Ma'am, this is about a patient. In fact, it is my husband itself. He is 50 years old and he is a practitioner. Homeopathic means BHMS. But since many years he stopped practice and he's having all these rubrics. What you are considered, ma'am? All these rubrics are there. Apart from that, there is fear of profession. He is not able to practice at all now, and want of self-confidence is there. And alcoholism and tobacco both is MM history. Actually, we have given stramonium, hyoscyamus, but none of this are giving me results. So wanted your opinion, ma'am.
Okay. When we take the case, we should to Master Hardiman says that don't prejudice during the case taking. So always see that every case have the new variants, new they are mostly cases are the different cases, and this is a way of the prejudice practice. If we solve your case, one medicine, one of the symptoms, like a same symptoms, patient washing hands, always mostly a lot of time washing hands, but this is not necessary. You can use the same remedy 2 and 3 medicine patients. So always take the case taking with the law of the case taking, and don't be prejudiced. So this is my advice to you. Thank you.
Okay, ma'am. Thank you.
Because Master Hahnemann not allowed to us. He always says that every physician should be unprejudiced.
So,
It's a valuable practice.
Dr. Anupama, I think she didn't get the answer. If Dr. Anupama, if you want, you can contact with her through the email, right?
Yeah, ma'am, I didn't get my answer because I have tried lachesis in LM potencies also on the basis of mind, alcoholism, fear, profession, want of self-confidence, benevolence, heedless, and alcoholism. But lachesis 0/1 also has no result. Apart from this, there is history of loss of parents, conflicts with friends. All these Natromure rubrics are there along with the OCD. So I was a bit.
No,
I
dear.
thought
I explained the compulsive disorder neurosis also, because there is not alcoholism. There is the repeated behavior. She
No,
says
madam,
that
she is asking another case.
yeah.
She was asking permission to you before that. Can I ask one case? She's not asking the obsessive compulsive disorder. She's asking another case. If have you
Ma'am,
got?
can we call you? Can we give you a
Yeah.
call and make you
If
talk to the
you
patient
can,
himself?
if you can give your phone number to Anupama, and she will directly.
sure. 0304
Yeah, ma'am. 0304. Yeah, ma'am.
83
Yeah, ma'am. Yeah, ma'am.
70
Yeah, ma'am.
466.
Yeah, ma'am. Let the patient talk to you directly because I may be prejudiced about him.
Okay. You will be shared separately because communication issues there. Some of here and some of not here there. So freedomly, I will see you. Okay.
Yeah, ma'am. 0304837046, ma'am.
Yes.
Okay, ma'am.
Double
Thank
six.
you.
No one in last. 466 only.
466, ma'am. Wait.
Yes.
466.
Okay.
Thank
Okay,
you.
ma'am.
Now, Dr. Danish.
Yes.
Good evening, all, and good evening, Dr. Tanzila. Doctor, it's a very
Good
nice
evening.
presentation, and the case was really a brilliant one. And all those
Thank you.
symptoms you for the repetition are excellent. And the conversion of the symptoms into rubric also was really excellent. And this kind of presentations are rarely happens with homeopathic doctors, but if everyone concentrate on this kind of presentation, definitely we can win over allopathic system in all psychiatric cases. the purpose of my hand raising is also one thing to mention about our program tomorrow, because as you know, homeopathy is facing a lot of challenges from all over the world, in different part of the world also. But in Kerala, in India, our state is known as Kerala, where a medical bill was implemented by the government of Kerala, and it was giving full authority to allopathic people to take control of situations, particularly during pandemic. And as we enjoy every right to practice all kind of patients nowadays, but almost all those things will be over once this medical bill is implemented. So we are going to protest against that thing tomorrow. But our governor, he is a very nice person. Our honorable governor has not signed on this paper. As a result, it is pending in the bill is pending now. So we want our governor not to sign on this bill to protect the Ayush medical system. As you know, Ayush medical system comprises of Ayurveda, Yoga, Unani, Siddha, and Naturopathy, and Homeopathy. So this is a thing that as far as India is concerned, it is the land where a lot of all these systems are being promoted, and the government is taking care of all these things. Central government, the India government is giving full coverage to all these Ayush systems, and they are practicing one label, Ayush, all these systems together known as Ayush systems, and there is a separate department for each systems also. So as you know, during the pandemic of COVID, homeopathy medicine, arsenic album was distributed all over India. But now the allopathic people are afraid of the growth rate of homeopathy and eye systems. So they want to take full advantage by throwing us from these kind of things. So tomorrow, our International Forum for Promoting Homeopathy, along with the other Ayush doctors and homeopathic lovers, togetherly conducting a march in front of the governor's residence, give complete support to him for not signing this bill. So this is a thing that we are going to do tomorrow. I want to mention all these things to you, because we have international people and doctors watching at Kerala or India, because India is said to be the mother of homeopathy nowadays. Some people used to say that Indian doctors are getting every advantage to practice whatever disease that comes on the way. But as far as other part of the world, things are entirely different. Here we have a system where most doctors have a degree in homeopathy, PG in homeopathy, and even PhD nowadays. So there is a full-fledged departments in homeopathy hospitals and medical college also. So we want all of your support for doing all these things, and wish you all the best to do all these things in your own country also. This is what I would like to mention at this juncture. Thank you all.
Thank you, Dr. Danesh. And now it is the time for the Malayalam session. Before that, for giving out of thanks to Dr. Tanzila, I'm inviting Dr. Muhammad Iqbal. Please say out of thanks to Dr. Tanzila.
And Dr. Anjim and all Ifph team and all Dr. Muhammad Iqbal, Dr. Muhammad Ali. Thank you so much to all of you. Jazakallah.
Dr. Tanzila, can you make Dr. Danish as a host? you are the host now, because when you when you are leaving the meeting, that